In this video, I'm going to be talking about the Invisalign instructions. This video is for someone that is going to start Invisalign or just started your Invisalign. I'll be going over my tips and tricks on how to have a very successful treatment. Here we go. Hey guys, this is Dr. Robert Passamano. I'm a board certified orthodontist. I've also treated over 3,000 Invisalign cases. I also have 9 clinical publications in the Invisalign books. So I'm here to talk about how to be successful with Invisalign. On the screen, you are seeing the Invisalign introduction kit. We provide an Invisalign case, a denture brush, travel toothbrush, some chewies, emery board, and then the virtual monitoring phone attachment. That's going to be the Grin. I'll be going over these in more detail in the next slides. This might seem obvious, but my number one Invisalign instruction is to wear your Invisalign at all times. That means 20 to 22 hours a day. That means 2 to 4 hours you are not wearing your trays. You'll use that time to eat, brush, and floss. I do recommend drinking only water with your Invisalign. Carbonated water is okay. I've also recommended for some patients that if you absolutely have to drink something like coffee or a blended smoothie, you can use one of those silicone straws and bypass the trays completely, go down your throat. That does work, but if you do get some of that liquid underneath the Invisalign tray, then you do need to brush and clean your teeth to avoid any damage to your teeth. The goal is 20-22 hours a day. Each bag is numbered 1, 2, 3, 4. You'll get a series of trays. You'll progress through those trays usually at a 5 or 7 day regimen. On the Invisalign tray, there is the patient ID number along with the tray number. The tray number will be representative as a U03N, meaning it's your upper number 3, or your L12N, which means it's your lower number 12. Your first tray is going to say U01 and L01. You're going to place your trays front to back, starting with the front 2 teeth and working your way backwards. Now that the trays are in your mouth, let's talk about chewies. What are chewies? Chewies help seat the aligner trays against the teeth to help activate those teeth to do the desired movements. The goal is to have no space between the aligner tray and your teeth. I do recommend that our patients keep the chewies in the Invisalign case, as you can see in this photo right here. And then when we look at this image down below, what we're going to see is that the yellow arrows are going to be okay fitting teeth. The red one has too much space between the teeth and the aligner, and the green ones are going to have very good fit. That's going to be very good. So in this case, I would recommend that the chewies be mostly used on the lateral incisors, which is the second tooth from the center. How do you use the chewies? This is the chewy technique. It's a bite and hold for 5 seconds per tooth. You'll use the chewies on the front 8 teeth. That's 4 from the center and 4 from the center. That's 1 tooth behind the canine. The canine is the pointy tooth. You'll do this about 2 to 3 times every single day. I do recommend that you use the chewies after each meal when you put the tray back in your mouth. Let's talk about how to remove the Invisalign tray. For the upper tray, you're going to use your right hand on your left side or your left hand on your right side. You'll be starting on the inside of the upper molar teeth. You'll pull down a little bit to disengage the plastic from the teeth. Then you'll pinch it with 2 fingers and you'll use this lateral rolling motion that is going laterally, not up and down, but laterally to disengage the tray from the teeth. That's also how you're going to do it with the attachments, because the attachments are on the outsides of the teeth. So that rolling motion will allow you to remove the tray without ripping or breaking the tray. Here's the example. Right hand, left side. And then rolling laterally this way, not up and down, but lateral. And now for removing the lower Invisalign tray, you'll start on the same side. So right hand, right side, hand, left side. You'll do the same thing where you disengage the molar first, but from the outside, not the tongue side, but the outside. And then you'll kind of do that same rolling motion laterally, not up and down, but laterally until the tray is removed. And here's how to remove the lower tray. I'm going to start on the right side. Right here, roll, and then out laterally, not up and down, laterally. And you do that rolling motion too. Let's talk about cleaning the Invisalign trays. You're going to brush your Invisalign trays every time you brush your teeth. You're going to use dish soap or toothpaste to keep your aligners looking nice and clean and fresh. I'm going to go into more detail about which specific toothpaste I like to recommend. Invisalign is clear, removable, and aesthetic. We want to make sure your teeth are looking clear and aesthetic. The attachments that get added to the outside surface of the teeth can stain if the teeth are not properly cleaned. Just like braces, sometimes food does get attracted to the Invisalign attachments. And so these are a couple of my tips to keep your teeth looking fresh, clean, and without stains. It is highly recommended to switch your toothpaste to a hydrogen peroxide based toothpaste. That's going to be Colgate Optic White or Arm & Hammer Peroxy Care. Both of those have hydrogen peroxide in there. The Arm & Hammer also has baking soda in there as well. It keeps things looking fresh. It cleans up all those stains. Highly recommend that if you are a heavy coffee drinker or tea drinker. Certain foods that do stain the Invisalign attachments are going to be turmeric, yellow Gatorade, curry. Those things do stain. So you want to combat that with hydrogen peroxide based toothpaste. And then additionally, if you want to be extra clean and extra white on your teeth, you're going to use something called Ever Smile White Foam that has a low grade concentration of hydrogen peroxide in the foam spray. You're going to use that about 3 times a day after every meal when you put the trays in. That's going to be right before you do the chewies. These are 3 patients that are 18 months into their Invisalign treatment. The 2 photos on the left are patients that did use the hydrogen peroxide based toothpaste. The one on the right did not, and you can see the difference. A lot more stains on the right side. I've even cleaned that. That's actually after cleaning the attachments. The ones on the left look immaculate, and that's what we're aiming for. Sometimes the edge of the Invisalign tray can bother your tongue or lip. I do recommend using an emery board or a nail file to smooth that plastic out. You're going to do a one-directional smoothing action where you go towards the tooth, not away from the tooth. If you go away from the tooth, you're going to make the issue worse and it'll bother you more. You want to go into the tooth, and that way you're eliminating that fraying of the plastic. If this is an ongoing issue for all of your trays, let me know and we can fix it. For most of you watching this video, you will be on a 5-day regimen. That means you're going to be changing the trays on a Monday, and then a Saturday, and then a Thursday, and then a Tuesday. It is very difficult to remember when you're supposed to change the trays, and therefore I do recommend the Invisalign app that's called My Invisalign. You'll download that. There's a QR code on your first Invisalign tray. You'll input your information, which tray number you're on, how many days per tray, and that way you can stay on schedule. You can also use your phone calendar. Either one's going to work great. Always bring your current Invisalign tray with you to each appointment. Invisalign has a patient store at InvisalignAccessories.com. You can get cool cases with logos, football teams, different colors and designs. You can also get different cleaners. I gave you the best cleaner, which is just toothpaste, the hydrogen peroxide based toothpaste. You can go on the Amazon.com Invisalign store. Just type in Invisalign store in Amazon and you'll find their store. It has everything you need to know. The second appointment for a lot of our patients is going to be about an hour and 15 minutes. That's when you add on all the attachments. I'll be monitoring your Invisalign treatment with an app called Grin. It is a virtual monitoring platform where you submit photos and video and messages to me on a regular basis. I usually do monthly check-ins if everything is going well. If you have an under 18-year-old patient that wants to use a smartphone, I do recommend the parent and the child both be logged in. This virtual monitoring improves our communication, meaning you can ask me any questions. It takes me about a day to respond. I also provide real-time recommendations to you, which helps decrease treatment time. You get a better outcome and also makes it so there's less in-office visits. You can see on the right side how the Grin scope works. You attach it to your cell phone, it takes a video, and then there's the chat box right there. Here are my top 3 accessories that are not included with the kit. For most patients, everything in the kit is all you need to have successful treatment. But if you're finding it difficult to remove the trays, you have short nails, you don't want to break a nail, the pool tool is fantastic. It's a little plastic end that can allow you to take off the tray and then you pinch it with 2 fingers and then remove it as normal. I also do like the Invisalign case with the mirror. I guess that's why a lot of people do have the mirrors with the compacts with the mirror. The Invisalign case with the mirror is also very nice, so you can see if there's food between your teeth. And then we've already talked about it before. The Ever Smile White Foam is great for keeping your teeth looking fresh and clean. Here's a few common questions I get. What can I drink with Invisalign? Water only. Carbonated water is okay. Anything that has sugar in there is not okay because the sugar will get underneath the tray and damage the teeth. So you definitely don't want to have anything like soda or Gatorade or anything like that. It's bad for your teeth. What happens if you lose a tray? Let's say you're on tray number 5. You've been on there for 3 days. You're supposed to be wearing it for 5 days, so you have 2 more days left over. My recommendation would be to switch to the next tray and then wear that one for 5 plus 2. So you're gonna be wearing it for 7 days. So my recommendation is to skip to the next tray, wear that one a little bit longer so that way you can stay on track. What if you forgot to wear your Invisalign tray for a day, meaning that you left your house, went to school or work and forgot it at home? That sometimes does happen. And so my recommendation is to add an extra day to your regimen, meaning that instead of wearing it for 5 days, you'll wear it for 6 days if you're on the 5-day regimen, or if you're on the 7-day regimen, you'll go 8 days for that tray. That day does not count as one of your days. This also happens if you have a special event, a wedding or something where you're not wearing your trays for 4 to 6 hours. You can't hit that 20, 22 hour threshold, and you're below that 16-hour threshold. That does not count as one of those days. What if my tray is bouncy on the last tooth? This is usually happens when you're removing the tray vertically and you bend the tray upwards, or when your tray is manufactured, when it's peeled off the template, the tray kind of bends upward. My recommendation is to rebend it downward. You'll take 2 fingers and 2 fingers and do a 45-degree angle bend downward towards the teeth, and that will allow the tray not to be bouncing up and down. Thank you for watching the Invisalign instruction video. If you follow all of these steps, I'm confident you're gonna have an amazing Invisalign result. If you guys like this video, don't forget to watch my other video, Invisalign Explained, and I will see you in person very soon if you're one of my patients, or I'll see you on YouTube for the next video. I'll see you later. Bye-bye.